Mr. Committee, David Smith with Anthem Blue Cross Blue Shield, Director of Governmental Affairs. Senator Ridgway, I'm glad you asked that question because all my comments are tailored to the exchange. And only exchange, I'm not here really to support or oppose anything. It's probably going to sound like I'm supporting, but really I want to take the opportunity to address some of the myths that are out there in developing a state-based exchange and kind of interject some facts because I think some of that gets misrepresented in many cases. So I'm just going to go down the line. I'm not going to read these 100%. I'm going to basically provide those to the committee. Myth number one, states are not required to establish an exchange. That's absolutely true. But with that, you run the risk of having somebody else shape the needs and the wants of the market in Missouri that don't necessarily tailor themselves to the state of Missouri. Myth number two, federal government doesn't have the money to establish a federal exchange, so if we don't, then they're not going to do it. I hate to tell everybody that, but HHS already has the funding. Through discretionary funding and their first allocation of funding, they already have the funding to develop a federal-based exchange. That's reality. And the other thing a lot of people miss is they only have to fund the exchange to 2014. The ACA gives the federal government the ability to tax insurance carriers or users or fees, etc., with the development of that exchange moving forward from January 1 of 2014 on. So they only have to fund that through the 2014 implementation date. Myth number three, if you establish a state-based exchange, you support quote-unquote Obamacare. I get that, I understand, but realize the exchange component is only one issue within the 2,000 pages of the Federal Act. 46, and I repeat that, 46 regulations have been instituted from the ACA in the insurance markets in Missouri since 2010. Some major examples, new rate review thresholds, anything above 10% has got to be filed. That's reality. Now, they don't have to necessarily be approved, but we got to put them in a public document. Medical loss ratio standards, between 80 to 85%, basically states that even though I'm incentivized to try to keep cost of care as low as humanly possible as an insurance carrier, the federal government is telling me that I have to hit a target of spending 80 to 85%, whether I'm in the individual, small group, or large group markets, on cost of care. If I don't, I've got to refund that money to the public or I've got to pay a penalty. That's just the reality. That's something that's in law today. That's currently we're under. And extending dependent age coverage to age 26. Those are all good reforms for the marketplace. But I didn't hear, I haven't heard any rhetoric as opposing those components, but when we go to the exchange, we hear a lot of opposition. So just want to make sure that that's clear that we're under the law. It's being implemented, regardless of where Missouri sits legislatively. With the potential wave of Republicans winning the Senate and the White House in 2012, I'm not here to tell you if that's going to happen or not, but the likelihood of gaining a 60-seat majority in the Senate is a very bold prediction. Haven't seen a poll that shows that yet today. As a result, the likelihood of a wholesale repeal of the ACA is fairly low. And even if the GOP is able to repeal some of the ACA, they're going to be under enormous pressure to fill that gap as far as coverage issues and free market principles. As seen through policy papers, and I know I'm probably going to, through the Heritage Foundation and the Cato Institute, but that's reality, they haven't published, that really pushes forward a state-based exchange. Any state that moves forward with the development of their state-based exchange is going to be ahead of the curve, regardless if the Democrats are in control or not. I understand that the favorability rate of the ACA is at an all-time low of 39%. 19% of Americans feel that the country's going in the wrong direction. And we know that the ACA and the presidency are going to be hand in hand in this election cycle. Just don't get caught up in that rhetoric, is basically what that message is there. Missouri doesn't have the money to establish the exchange. All right. Well, this is the key one then, I guess. I'm going to go right to it. We hear a lot about the Supreme Court and going into June. We all know that it's probably going to happen mid-year in 2012. The ACA, basically the myth is if the ACA or exchanges moves forward, it's going to undermine the federal lawsuit. I wanted to give you a fact associated with that. Since implementation started in 2010, 27 states have filed a lawsuit against the federal government. 25 of those states have joined with Florida in that lawsuit, 2 of them are in Oklahoma and Virginia. 15 states out of the 27 have either passed or through executive order, or through pending legislation, advance their exchange development. All of them have received federal funding, up to $1 million. Every single one of those states, 100%. And 3 have received level 1 grant money that Missouri has. I'm not here to predict, I'm not here to change the past, that's just reality. I'm not here to move forward because it's an unknown. But the reality is we have control over our markets today. They are extremely unstable. We're not seeing a lot of new business. Move from carrier to carrier. Commissions with broker structure and the distribution channel is out of control, and we'll move on from there. I'll answer any questions with this.
Thank you very much, Dave. We have access to you for questions. We see you quite a bit, so we'll probably pass on those.
And I'll provide you my full review.
We'll make sure it's given out to everyone here today.